Hi, I want to thank you for attending Essential Hospitality's Benefits at a Glance. Benefits will begin June 1st, 2022 and go through May 31st, 2023. This is the time when you should make your election if you want to add dependents or remove any of your dependents from any of the benefits being offered. After you have enrolled for June 1st, 2022, the only way that you can have a change in your status is if you have a qualifying event. A qualifying event is a marriage, divorce, birth of adoption, death of a spouse, death of a dependent, loss of dependent status, loss of spouse's job where coverage is maintained through the spouse's plan. You will have only 30 days to make these changes, and you will need to supply us with supporting documentation. On the front of the Benefits at a Glance, we did give you information on how to look up a provider for both medical, dental, and vision. Also, a friendly reminder that dependent children will age off of the medical, dental, and vision at age 26, and they age off on the last day of the month. You will have 4 Aetna plans to choose from. The network is the same for all 4 plans. I did want to bring to your attention just a friendly reminder about what a copay is. A copay is a fixed amount that you pay for a covered healthcare service, usually when you receive the service. The amount can vary depending on the type of coverage that you get. As in this example, the first plan is a $15 copay and the specialist is a $100 copay. There is a coinsurance for all 4 plans. Your coinsurance is your share of the cost of a covered healthcare service. So in this first example, if you were to go to an x-ray, you would have to meet your deductible plus 20% coinsurance, which brings me to what a deductible is. The deductible is the amount you owe for a healthcare service your health insurance or plan covers before your health insurance or plan begins to pay, which means you're the first dollar will come from you before the health insurance will cover anything. Each plan has a deductible and an out-of-pocket maximum. An out-of-pocket maximum is the most you will pay in a calendar year, not including payroll deductions, before the carrier is responsible for 100% of your care. Each plan does offer a full prescription drug program. We've included information as a friendly reminder that your friendly Walmart, Winn-Dixie's, GoodRx offer discounts for prescription drugs where you would not even give your health insurance card. We've also included information on how you can log in as a member for the Aetna website, how to use your Aetna ID card. And please keep in mind that as an Aetna member, you can go to the CVS's and have no cost share whatsoever, which we've included that on page 2. Also, each plan offers preventative care at no cost share as well. Aetna also has a unique program where you can earn rewards that help pay towards an Apple Watch. More information can be found on the Attain app as well as Employee Navigator. There is also discounts through Aetna that you can earn yoga, CrossFit, boxing, and much, much more on classes registering. Again, information can be found on the PearFit website as well as Employee Navigator. Dental, you will have the choice of 2 dental plans to choose from. One is a DHMO, which means it has a fixed cost for any time you go to the dentist. You must pick a dentist that's in network and stay in network. There is a PPO offer as well where you have in and out of network benefits. Both plans will offer 2 cleanings a year. The DHMO, you have the option of going 2 times a year, but under the PPO plan, you have to go 1 every 6 months. The fee schedule can be found on Employee Navigator as well. If you are enrolled in the dental plan, then you have the opportunity to enroll in the Guardians College Tuition Benefit Program. Additional information can be found on the Guardian College Tuition Benefit website, but for every dollar that you spend in registering members, you can register your child, your godchild, your neighbor's kids, the Girl Scout team, whoever you would like to register, you earn reward points, which turn over into true tuition dollars. So if you have a child that is going into, or a niece or a nephew going into college in their junior year, and they are enrolled in one of the colleges that participate in the college benefit, then this would be true tuition dollars. It costs you nothing but your time for registering. There is additional guidelines that you'll have to follow, so just log on to the Guardian College Tuition Benefit website and you can learn all about it. There is a vision benefit that you can enroll in. Davis Vision is the network. There's a $10 copay to see a provider. Lenses are $25 copay. There are a frame allowance where you can spend, they'll give you up to $130 plus 20% over the balance for any cost of the frames. Contact lenses, you also receive an allowance and a discount. There is no additional discounts if you go to Costco, Walmart, or Sam's Club and some private practices because these are already discounted. If you use VisionWorks, there is an extra $50 that they will provide to you. Again, there is out-of-network benefits as well, but as you can see, the reimbursements are very low. You can have an eye exam every 12 months, contact lenses every 12 months, or lenses changed every 12 months, but your frames are every 24 months. You will have the opportunity to enroll in a critical illness benefit. This is a benefit that will pay you directly. So if you were to find yourself having a stroke, a heart attack, Parkinson's, cancer, it pays you directly, not the hospital, not the doctor's office. It's a way to help ease the burden of the additional bills that will be coming in. You could use it to pay your rent, your mortgage, your food, take a trip, however you would like to use it. Additional information, again, can be found on Employee Navigator. You have the opportunity to enroll in a $10,000 benefit if you were the employee, a $5,000 benefit for a spouse. Children are $2,500, but they are included, their cost, in the price of the employee. But you will need to make an election for them if you would like them to be enrolled in the critical illness. There is an employee assistance program that is being provided to you at no cost. You get 3 face-to-face meetings. You can have 24-hour call if you needed somebody to speak to regarding education, dependent care, lifestyle and fitness management, or if you have some legal and financial questions. Life insurance and death and dismember. Essential Hospitality is providing all eligible employees with a $25,000 life insurance benefit as well as a $25,000 accidental death and dismemberment at no cost to you. Identity theft. This is being offered to you by LifeLock. You have the choice of 2 plans to choose from. As I started with the meeting, that we will be using Employee Navigator to enroll in benefits. As you can see, here are the instructions for first-time users. You will select register as a new user, create a username and password. You will need to provide your first name, last name, and the company identifier. Please keep in mind that the company identifier is case sensitive, so you will need to enter it exactly how it is shown. Next, You will create your username and password. A lot of people, we suggest use the email address that's being provided by them from their company, but if you are not given one, that's fine. You can make up your own username and password. If you're a returning user, you would log on to Employee Navigator, enter your username and password. If you have forgotten your password, enter your username, click on Reset a Forgotten Password, and a link will be emailed to you. And then just follow the prompts. Please note that all employees that are eligible for benefits must log on, enroll in either Wave or enroll in their benefits. You will know that you have gotten to the end of the page when you get to the enrollment summary and it asks you to click on a green little button that says click to sign. This will be your new payroll deduction for benefits that begin on June 1st. If you have any questions or trouble with logging on, please feel free to reach out to Debbie Rito or Colleen. Thank you, and I hope you have a great day.